Hey everyone, my guest today is Dr. Jason Pingel, owner of Mission Eye Care with locations in Mission and Lawrence, Kansas. Jason is also a consultant for Johnson & Johnson, and he's done some work and traveled extensively really throughout the world. So we'll be looking forward to hearing a little bit about that, perhaps during our discussion today. Jason, thanks a lot for spending some time with us today.
You're welcome, Eric. Thanks for having me today.
Yeah, you bet. So I always love to ask, just before we get into the all the great things you are doing today and now, is tell me a little bit about your background and really how you got into the optometry profession.
Yeah, I grew up in Iowa and born in Nebraska. I decided in undergrad I wanted to do something in the medical field. And one of my fraternity brothers, who was a few years older than me, had already been in school in Chicago. And he's like, this is such a great field. You should really consider it. And I went out there for the weekend, toured the school, met a bunch of his friends, and loved the city. And just knew that that's where I was meant to be. And the rest has really been history. I've been a doc now for 22 years. I graduated in 2000, and it's been quite the journey. I bought my first private practice in Kansas City here about 10, 11 years ago, and bought a second location, as you said, around 2 years ago. I also started consulting and speaking for Johnson & Johnson for probably about 12 years now as well. And that's taken me to hundreds and hundreds of practices around the country and hundreds of speaking events. It's been such a great journey, and I've gotten to network with so many amazing other colleagues around North America and beyond. It's been wonderful.
Excellent. Yeah, that's awesome. So tell us a little bit about that, because you're in private practice. You've done that for, what did you say? Like it's been quite a few years now in private
Yeah,
practice, and
22 years. Yeah.
22 years in private. So, you've done that, and you've also, branching out and doing all these other things, consulting. I mean, usually when I talk to people, it's when they have a lot on their plate or a lot going on. It's because they're looking to serve like a bigger mission overall and they have a bigger purpose in life that they're serving through their profession, right? So what would you say is the bigger mission that you're looking to serve?
I think when I first got out of school and I was out on my own, I was kind of in an area in rural Iowa where I didn't really have a lot of colleagues to call on that could really mentor me in those early years of kind of running a business and a medical practice. And I always thought back to that years later, like, gosh, that would be such a great way to give back. I've always been huge on being a lifelong learner myself, but also to teach what I know as well. And I also have always had this ambition to where I'm never just happy with status quo. So even in my own practice, I constantly have been striving to improve it, make it better, and have never been afraid to talk to other people and learn and be like, hey, how could I do my ways better? What am I missing here to improve it? And I think that's taken me some pretty amazing conversations and things that I've been able to bring back to my practice and share with others. When COVID hit, that presented some really unique challenges that I don't think any business owner really could have, figured out on their own. I started a private Facebook group, and it grew to like 50 local ODs, and we were all just back then saying, "Hey, what do we do for this? How do you get these PPP loans? And what are you guys doing as far as furloughing and whatever? And how do we survive this together?" And it was incredibly helpful. Probably about 12 years ago, right before I went out on my own, I had a 1-year non-compete. And my longtime J&J rep said, you should really think about this speaking thing and consulting. I think you'd be really good at it and you've got a lot to share. And I always thought I'd do it for a year just while I was, not working. But I fell in love with it as far as the education piece and as far as just networking and meeting people and learning from them and teaching them some great ideas I had to. And it sparked something inside of me, I think, about just figuring out ways that I could make optometry better, right? Like it's given me so much. I was like, how can I make the industry better with my little, thing that I do over here? And so I really have this thought that the rising tide floats all boats, right? And I think that especially for private practice optometry, we need all the help we can get. It's hard enough to be a doctor, right? But you have to be a business, person too in optometry specifically because you're selling glasses and contacts. and not all of us are CPAs like you, right? And we don't have MBAs and things, and we kind of learn as we go. So some of us hired consultants like I did years ago, to learn for a year how to do the business side of things. And some of us have learned from senior doctors. But I think that there are a lot of opportunities for a lot of us that have been doing this for a while to share with the younger group so that they're not at risk for failing, so that they have the best chance at success as they navigate their careers and run their businesses as they, go through life.
Absolutely. That's awesome. No, that's great on so many different levels. I want to know where to start kind of elaborating on that. I think you did a great job with that. I do want to hark back to one thing you said early on in there, even though it was all great, because I don't normally get other people who grow up in rural Iowa. That's my story too, and I'm still here, but you're just next door in Kansas. But what? Just out of curiosity, do you mind sharing what part of Iowa did you grow up in?
So I grew up in Sioux City, Iowa. And
Okay.
then when I graduated from optometry school, well, I went to Iowa State for undergrad too. So I was in Ames for a bit too. So Sioux City up to Ames. And then when I graduated from optometry school in 2000, I had an opportunity to start a small Walmart practice because Walmart was just back then starting to expand into vision centers quite a bit more. So there was this little town, Indianola, Iowa, and Knoxville, Iowa, right next to it. So I lived kind of, on the outskirts of one of those towns, and we were trying to start two practices. I did that for about a year and a half, and then I had a private practice opportunity in Des Moines for about a year and a half after that, and then in '03 moved down to Kansas City and worked for a fella in private practice for about 7, 8 years. Learned the ropes, and then in 2010 left there and went out on my own 2011.
Okay. Nice. Very good. So as you think back through, the career and the path it's taken and the progression that you've gone through, like what do you suppose have been some of the toughest challenges you've had in kind of bringing your ideas about, how you're helping the industry and how you're running your practice, turning those ideas into reality? What have been some of those the toughest challenges you've had to overcome?
I think one of the toughest challenges, which has gotten a little bit easier, I think, in some regards and tougher in others, is just trying to reach people, right? I think that, before Zoom, before the pandemic, there wasn't really great forums like Zoom to be able to reach a lot of people quickly. So that has made some things easier as far as networking with other doctors. But it also has made it harder, when the pandemic hit, to travel and be there in person, which I was used to doing a lot of too. So I really think just having a forum where eye doctors can connect really easily and have these groups or whatever, I think has been somewhat of a challenge. I also think there's a lot of doctors out there that they're afraid to admit that they need help. And I think that there's a pressure from a lot of doctors clinically to be like, you always know the answer, you know the diagnosis, and you know the treatment. So I think we have that mentality on the business side, like, well, I'm just expected to know this stuff, and I don't want to look like an idiot and ask questions that I don't really understand this stuff. And I will tell you that optometry schools, for sure, when I was doing it, but even nowadays, you really don't get much business at all, to really learn what it takes to run a private practice. And then you come out with these crazy loans, right? Like $250,000 or more loans that are, more than your house mortgage. And the young people that are coming out, they don't know how to run a business, and they have all these loans, so they can't buy a business. So they end up going into, commercial or corporate optometry. But maybe some of them have dreams and aspirations to have a private practice, and they really need a lot of help with that along the way. I did certainly too. And I think that presents a challenge too, is that it's become really expensive and it's a lot of hard schooling to become an eye doctor. Yet we are facing ever increasing challenges on the retail side. I'll give you a couple examples. Most vision insurances haven't given eye doctors a raise in what they pay us for reimbursements for an eye exam in 15 to 20 years. We're still making, in some of these cases, $40, $45, $50 for an eye exam, whereas my wife's a hairstylist, she makes $150 just coloring and cutting hair, right?
Yeah.
And we're doctors and we're accepting $40, $45, $50 for an eye exam, yet our cost of goods has probably doubled in the last 15 or 20 years, right? At least. And you look at just the last year and a half with inflation, with how much more we're having to pay staff now just to keep them because the turnover has been so high, and there's such a shortage of workers, not just in our industry but everywhere. So you're having to pay so much more for workers, and your overhead's much more expensive, equipment costs, and everything has gone up so much, yet we're still limited by insurance of what we can charge. And that presents a big challenge, because if you can't really set your own fees, and you can argue like, oh, well, you can just not take insurance. But the reality is most of us are forced to take insurance because everybody else does. And if you don't take insurance, your books aren't full. So you really are forced to do that. But I really truly feel that, vision insurances have not been paying a fair, reimbursement for many, many years. And that is creating big challenges for eye doctors. I think another challenge would be the reason you see a lot of private equity taking over a lot of private practices. And in Kansas City, just last year alone, there were like 4 or 5 major private practice groups, some optometry, some ophthalmology, that were all bought out in 1 year by private equity. And as somebody who travels all over the country and visits private practices all over the country, I can tell you it's happening everywhere. And I think it's because a lot of the little guys are just like, man, I just can't compete anymore. My margins are so slim. I'm barely making it, and that's really tough. And I really think that this country was built on small business, and I think optometry is no exception. I think that the doctor-patient relationship is a very important thing, and I think private practice does an excellent job, better than most, at protecting that relationship. And I think we need to do everything we can to keep private practice and small businesses strong. And that's really what I've focused on in my travels and in my consulting.
Oh, that's awesome. So yeah, I mean, and I see that on our end too. And it's kind of crazy when you think about it, because a little bit ago, I mean, a lot of things in there, but a little bit ago, you're talking about essentially the lack of small business, or small business training that doctors get as they're going through optometry school. Like, there's not even a path to do that. So if you wanted to own your own private practice, you're essentially, like you said, you're hiring consultants, or you're getting a mentor, or you're getting somebody who has that experience. And as you were talking about that, thinking back to going through like accounting school. So we take a lot of business courses, but even those are geared towards the corporate atmosphere, right? And now, of course, since we've been through college, there's a better development of some entrepreneurial programs that kind of the small business and entrepreneurial programs in a lot of areas have really taken huge steps forward than what they were 20 to 30 years ago. But they were still there. They're just better now. But even then, right? So like just kind of relating experiences and thinking, well, I'm a small business CPA, and I didn't have kind of quote unquote small business training, because that's all vastly different. And even accounting and accounting and taxes and everything for a small business owner versus what you learn, somebody like me learns in college, right? Completely different. Some same underlying concepts, just like corporate management versus small business management, but at the same time, completely different worlds and a completely different approach. And there's so many things that you just have to work through and gain the experience, or like you said, gain a mentor that has had that experience, because it's not being taught elsewhere in like a formal academic setting, or at least it wasn't before, right?
And it can be simple things like learning how to leverage your relationship with certain vendors. I talk about this one thing, like there's 3 types of vendors or business partners that you may work with. There's ones that are trying to proactively build your business up. There's some that are kind of like Switzerland. They're not, positive, negative. They're kind of neutral. They don't really help or hurt your business. And there's some vendors and companies that optometrists can work with that are proactively like damaging our business on the back end of things that we don't realize, by doing things like underselling their same products to like the big guys for half the price, so you're not even on a level playing field. There's also a lot of vertical integration, which I can only describe as a monopoly that's been allowed to go on. There's there's one company that owns like 70% of the frames in the entire world, frame companies in the world. And then they also own by far the largest lens company that makes ophthalmic lenses in the world. And that company is also buying vision insurance companies, and they're buying practices, and they're the insurance company too. So they are vertically integrating everything, which makes it a scary and completely tough situation, that I'm actually amazed has been allowed to go on as long as it has. But it makes it even that much more of a difficult situation for eye doctors to feel like they can thrive in. And I think the saddest thing for me is when I talk to some of these doctors and I ask them, we always talk about, hey, tell me about your family, your kids. I always ask them, I'm like, would you want your kids to be an eye doctor? And when I first started practicing 20 some years ago, most of them were like, oh man, I would love that. I would love them to be an eye doctor, take over my practice someday or whatever. And I will tell you more often than not, I get some pretty sad or scary no's, like, I don't think so. I think it's already tough right now. And I can only imagine what it's going to be like 20 more years from now. And that makes me sad because I think optometry is an incredible career. I think it's one of the coolest jobs. I think if you talk to most eye doctors, they love their work. They love what they do. They don't like vision insurance and they don't like dealing with the crap that we have to nowadays, but they love seeing patients and helping the world see. And I think if we could get back to the simple pleasures of that by solving some of the problems that are making optometry really frustrating, difficult to succeed, I think you would see a lot more people thriving. And one of the things I do when I travel to consult is really helping doctors to do just the little things different. And that's really it. The practices that I see that are thriving versus the ones that are really struggling, it's really about just doing this much different, little things differently. And when they do those things, they're much, much more successful. And I think that having a platform for us to kind of share those best practices is really kind of what I've tried to do over the last 10, 12 years that I've been consulting. And what's been great is J&J, since I travel so much for them, I'm able to use them as an example of some of the great things that they're doing for small business and private practice too, which has been great. They allow me to be able to travel and do all these things, but because it would be, impossible for me to pay for all these trips and flights and hotels and everything to get to all these practices. But I really think it's a great symbiotic relationship because I'm able to help those practices grow their businesses and J&J, get somebody who believes in their products and what they're doing too. And I think that's a win-win for doctors.
Sure, sure. So, well, we've been talking a lot about the challenges and things, and we started to get into some of the good there at the end of that. But kind of elaborate on that, or tell us more about some either victories or successes that have been really quite meaningful to you over the course of your career.
I think one of the coolest things is that when I travel to visit a few practices, I always have the local reps that, help me to coordinate all those visits and things kind of reach out back to me over the coming months and even years later. And some of the stories that I hear about the growth that they had after that visit, it really is fulfilling for me. When I hear a practice has been stumbling and really, struggling with a lot of things, and then they take some of those things we talked about in just those brief 1 or 2 hour visits that I'm with them, and they suddenly start growing exponentially, like that's really cool. I feel like that made it worth my while to go do that. I'm a big champion for optometry, and my little local Facebook group here in Kansas City of ODs, there's like 50 of us. They know I'm their biggest cheerleader. There's enough business to go around, and I want all of them to be wildly successful. And they call me all the time, and I even call them sometimes, or else we'll shoot ideas on the group, and whatever. And I want them all to be wildly successful. And that's what I want for all these practices I visit too. I really, truly believe in what optometry does for the world as far as, this gift of sight and helping the world in that regard. I also think we're kind of the gateway health keepers to a lot of hidden diseases that you find first in the eye. that maybe affect us systemically. And I think that that's an important thing too. And and I just think that if all of us really focus on what we can do as a whole better, I think that the whole industry would be even more successful than it is now.
Yeah, for sure. That is when I hear you talk about that, that is like the exact definition I would have in my mind of an abundant OD, right? An abundant an abundance mindset, and just going out there and like you're saying, there's enough business to go around. We love the industry. We love all the people in it. It's like let's lift all of those, lift all of us up together, and make the whole stronger, rather than thinking that we're because we get into this too where and every small business owner does at some point. So it's great that you have a forum for your local doctors there as well, because we all of us, I think, at some point in time get into this mindset of where it's like floating out here alone by ourselves in the small business world. I mean, I think every small business owner, don't care if you're a doctor, CPA, anybody else, has kind of had that feeling or thought at some point in their career that, man, it's, or at least their world there seemed to be a lot smaller than what it was as they're going through some of these issues and working through the challenges, right? So that's fantastic. We've talked about a lot of great stuff here today, Jason. This has been awesome. In kind of summing this up or wrapping it up, what's a core piece of advice? What's kind of like your go-to advice you give to others as they're moving along on their journey?
I would say don't be afraid of change, right? You have to constantly keep reinventing yourself and your practices, because if you're just standing still, the rest of the racers are running ahead of you, right? And you're falling behind more. So I would say don't be afraid of change and be proactive rather than reactive in your business. Try to see ahead down the road and be willing to go out there and seek advice from others, because there's no point in reinventing the wheel if somebody else has already been there. Learn from their mistakes. I've made plenty in my career, right? But I've learned from them. And I've never been afraid to call my baby ugly, and if there's something I can be doing better, being open to that is the best way that we can find success in our future, is to just keep thinking forward.
That's great. That's great. Jason, thank you so much for taking the time today. I truly appreciate it. It's been a pleasure.